Welcome back to the channel. Thanks for joining here at Unapologetically Progressive. Today we're going to talk about the new Trump HHS transgender report over trans youth and proper care for trans youth. Now, in this article, one of the people that are supportive of Trump's policies here from the National Institutes of Health will tell you that we need to follow the gold standard of care and not activist, agendas. That's what you're going to see in this article. And I want to make it very clear, we are already following the gold standard of care. We are following the American Medical Association's standard of care. We are following the World Transgender Professionals Support, organization, following their rules. So we're following guidelines from some of the top medical organizations in the entire world. So we're already following that. We already have a good standard of care that is the gold standard that is followed by countries across the globe. But let's get into this article a little bit, shall we? Of course, Trump's HHS urges therapy for transgender youth, departing from broader gender-affirming health care. President Donald Trump's administration released a lengthy review of transgender health care on Thursday that advocates for the greater reliance on behavioral therapy rather than broader gender-affirming medical care for youths. The 409-page Health and Human Services report questions the standards of treatment of transgender youth issued by the World Professional Association for Transgender Health and is likely to be used to bolster the government's abrupt shift in how to care for a subset of the population that has become a political lightning rod. The new best practices report is a response to Trump's executive order days into his presidency, or days into his second term, that says the federal government must not support gender transitions for anyone under the age of 19. Now, many people are going to see that and think, oh, there must be a big problem, right? That all sorts of people are getting gender-affirming cares used. All transgender youths are getting surgeries and puberty blockers and hormones at a very extremely young age, and it's not true. It's not true. That's the argument that they're going on. The argument that they are going on is the fact that this happens to people that are 5, 6, 7 years old. First off, puberty blockers are, if prescribed properly, are 100% reversible with normally no adverse reactions. There's a small percent, I think it was like less than 3% chance of some issues with certain development, bone density, things like that, because you don't get some of the same option, you don't get some of the same puberty hormones and stuff that you would get, if you're blocking puberty. Now, the thing is, as soon as puberty blockers are stopped, puberty begins, right? So that's really not that big of an issue for most people as long as the medical professionals are following proper protocol. And I believe that they should be following proper protocol. I completely agree with that. But at the same time, we got to make sure that we're not trying to one size fits all everything. It doesn't work. Let's get back to the article. According to the director of National Institutes of Health, Dr. J, I'm not going to pronounce his last name because I can't. We must follow the gold standard of science and not activist agendas. And like I said earlier, we're not following anything but the gold standard of care based on science. What it is people like Dr. J here in the Trump administration are the ones that are running off of activist agendas and trying to project as if it's other people that are doing it. The people that treat children with gender dysphoria and adults with gender dysphoria have studied this stuff for years. They know exactly what they're doing. They know exactly what the science shows, and they have for decades. It goes on to say that the report sharply contradicts guidance from the American Medical Association, which has urged states not to ban gender affirming care for minors, saying that empirical evidence has demonstrated that trans and non-binary gender identities are normal variations of human identity and expression. HHS said in its report, however, it is not clinical guidance, but does not make any policy recommendations. The report is also limited to children and does not affect um, adults. Well, as I mentioned earlier, um, Trump's executive order already made it clear that some adults would be affected by bans from the federal government because he believes people 18 years old who are legally able to go to war, legally able to be sent to adult prisons and things like that, would are not eligible for gender affirming care. They shouldn't be, according to him. Um, it goes on to talk about gender affirming care here and for youth. It says gender affirming care for transgender youth under standards widely used in the U.S. includes supportive talk therapy and can but does not always involve puberty blockers or hormone treatments. Um, The Trump report also states that many adolescents who are transgender or are questioning their gender identity have been given surgeries or received surgeries and medications, and it goes on in the article. In fact, such treatments remain very rare as a portion of the population. Fewer than 1 in 1,000 adolescents in the U.S. receive gender affirming medication, such as puberty blockers or hormones, according to a 5-year study of those on commercial insurance released this year. About 1,200 patients underwent gender affirming surgeries in one recent year, according to another study. So, as you see, for the overall population, it's extremely low. The number of people that receive hormones or surgeries is extremely low from the overall population, and even, and fairly small within the transgender population as well. Literally 1 in 1,000 people, maybe. 1 in 1,000 people. We're not talking 1 in 5, 1 in 10, 1 in 100. We're talking 1 in 1,000 people may receive Medicare or medical transition, such as puberty blockers, hormones, or surgeries. Because typically, if you're not on hormones, you're not going to end up having that surgery done until you've been on hormones for a while. Um, at least from what I have read. It goes on to say many U.S. adolescents decide not to proceed with gender affirming medications or surgeries. Medical Association recommendations say the best care includes developing a plan with medical experts and family members that includes psychotherapy for each young person. Um, Shannon Minter, which is the legal director of National Centers for Lesbian Rights, says it's chilling to see that the federal government injecting politics and ideology into medical science. She went on to say the report could create fear for families seeking medical care and for medical providers themselves. Just like the anti-abortion laws that have come out, not only is it a problem for the people that are seeking the care, but it could create a problem for the people that are providing the care or try to provide the care. It could lead to states passing more laws, not just banning it, but threatening jail time for anybody providing any kind of gender affirming care, whether that be, talking about, talk therapy, psychotherapy, and things like that, or even medical care. So as you see, this article has laid out pretty clear what's going on. It's giving you um, a number of quotes from directly from people involved in this particular line of work. And the fact is, this flies in the face of science. It flies in the face of fact, and it flies in the face of dignity, decent dignity to people. They have no shame, and they don't care what they're doing to people. They don't care who they're hurting. They don't care if a child is going to end up unaliving themselves because of this. They don't care. But the fact is, children need help. As it pointed out in this article, one thing that the guidance suggests is psychotherapy, and psychological help, counseling before you even get to any kind of medical intervention for children. Now, I understand you want to protect kids. I know a lot of people out there think that kids can't make this decision, that kids don't know who they are until they're magically, 18 or 19 years old. Supposedly they know exactly who they are. But when it comes to gender identity, that is something we develop early on in life. Typically somewhere between 3 to 5 years old. We know. And if you think this is a choice, if you're one of those cisgender people that think this is a choice, please leave me in the comments to let me know exactly what age it was that you decided you were cisgender. Let me know. Let me know in the comments. Because I bet you don't have an idea. Because it just was. It was just something you felt and it just was. Many of us didn't grow up like that. I can tell you from my personal experience, I did everything I could to be a boy. Everything I could. I tried to play football, tried to play baseball. I tried to go, you know, you know, be with the boys and hang out with the boys, but I never felt right. Something always felt off. Always felt off. From the time as long as I can remember, something felt off. It wasn't until I was 10 years old that I knew what that off was, why I felt off, why I didn't feel like a boy, and why I never had. Why I had always felt like a girl on the inside, and how I always felt that way. If this was something that just went away, I would have buried it. It would have gotten buried after I got married. One of many reasons I believe that I waited so long to get married was I really thought this was going to go away at some point. I really thought that I could just bury my feelings and that they would never bubble up to the top. But unfortunately, it's for a lot of people, it doesn't go away. And if the work I do here on this channel can do one thing, if it can help one child not feel alone, if it can help one child not go through the things I went through as a child, if it can help one child not have the self-loathing that I felt for 41 years, because even before I was 10 years old, I hated myself, and I didn't know why. Every time I looked in the mirror, I hated what I saw. And it only got worse throughout puberty. If I could have had gender affirming care when I was a child, I wouldn't have all this. I wouldn't have all the trauma that I've dealt and carried, that I've dealt with and carried all my life. And I know that's probably the same for a lot of other transgender adults that transitions later in life. I've come across a lot of people through social media that repeat verbatim how I felt growing up. And how if they could have received gender affirming care at a younger age, how their lives would have been so much better. When I was a kid, I was too scared to talk about that stuff. And when I found out about it about what I was, that it was okay, that it was normal for some portion of the population to have these feelings, to not express their gender as the gender that they were assigned at birth. I didn't find that out until I was 15 years old in the mid 90s. But I was too terrified to say anything to anybody. I was scared. And so I didn't. And I pushed it down. Did my best to bury it. And it didn't go away. There was a point where I was still trying to be happy. Right? I was perky. I was always trying to put on a good show. And I had a landlord that told me when I guess by the time I was just before I got married, when I was about 27, she's like, "Where's your smile? What happened to it? Where did it go?" And I bit my tongue and I left. Why? Because I didn't want to tell her the truth. I didn't want to tell them that the reason my smile was gone was because I had been burying something for so long that it was killing me on the inside. That every day I woke up, I felt like I was just dying a little more. For years before I came out, over a decade before I came out, I woke up every day wishing I was dead, wishing I had not woke up. That is what I that's how I woke up every single day for over a decade. But that's also why you saw me supporting the transgender population and community here on this channel from almost the very beginning. Because I couldn't transition. I didn't know how to go about that even then. Just just 10 years ago, I didn't would have known how to go about it. If it wasn't for people like Jazz Jennings, I would have never known that gender affirming care was even an option. People like Jazz, they're the ones that pushed me through. And the thing that solved that, trying not to get emotional here, but the kid that showed me how to be brave enough to support my community and to finally come out wasn't even a teenager at the time that I came across their story on Vice. The story of Kai Shapley. It made it very clear to me that if this child could be brave enough to stand up for themselves and to say, hey, they were a girl, that I as an adult could do that. And it still took me several years to be able to come to grips with the fact that I was in fact transgender. And I really wanted to transition. I've wanted to do that since before I came out. But I was always scared because I was scared. And then I came out and I thought, okay, well, I came out during the Biden administration. And I thought things were looking up for our community. And I really thought maybe I'd be able to get care if I had the money or found the insurance to do it. And then before Trump took office, I found a doctor here in Norman, Oklahoma, who said they could help me with gender transition. That at the time, it was like December 9th, is when I went to this doctor last year. And she said my Medicare or my Medicaid at the time would have covered it. Now they won't, or at least pretty soon it won't, because Trump's executive order and orders from people like Dr. Oz, who are in part, in part control of different health factors of the United States for Medicare and Medicaid, has said that they no longer will cover that. So it's unfortunate. Now I do have a different kind of health care. I don't have straight Medicaid, so maybe I'll be able to get around it for now. But right now, in many states, reports like this, even though they're focused on transgender youth, they will be used against adults, no matter what they say in their literature. And so, let me be clear. Transgender people are normal human beings. They just see life a little differently. They view things, through a different lens. All right, they don't see their gender as what they were born with. The parts between their legs, that's not gender. That is sex. You can be assigned male at birth or be assigned female at birth, but not identify with the gender that typically goes along with that. They're not two in the same. Anyhow, thank you for watching the video. I hope this was helpful to somebody out there. Just keep your head up. You know, just um, just keep going. That's all we can do. All we can do is keep fighting. Um, if you're in a situation that's unsafe and you have the ability to get out of the country right now, if you can, do. Like I would, if I physically thought I could become a citizen of another nation and I could get the care I need and the financial help I need to survive, I would. But most other countries won't take me because I'm disabled, can't work, and this is about all I can do is sit here and make videos. Anyhow, y'all have a great day. I'll see you down the road.